Hello, hi, welcome to my channel. This is Dr. Erica Onigbola, pharmacist for close to 10 years now. I am going to talk about 5 particular anti-diabetic medications for glycemic control. And these particular medications have been on the market for quite a while and have redeemed their and sustained their indications in the market for treating diabetes. So I am very proud to go over these medications with you all today. Um, Diabetes is very prevalent, especially type 2 diabetes. Most people who don't even know they're diabetic are either pre-diabetic or actually diabetic but haven't been diagnosed. Diabetes is reversible through exercise and proper dieting and nutrition. There's currently no cure as far as medication or surgery, but there are some new medications that have come out on the market to help reduce the progression of type 1 diabetes. And I have a video upon that you can watch. And that particular medication has been recently approved for type 1 diabetes in adults and pediatric patients alike who are in early stage. And so that is, as far as curing goes, that is the only medication that is available thus far. So diabetes meds, I'm going to start with the glucagon like peptide 1 mimetic, which is a medication that helps with increasing insulin production by the pancreas. It helps increase insulin production. When we get more insulin, we get less glucose plasma in the blood, which is what we want. A1C is reduced from 0.1% to 1 total percent reduction. We see that. And we also can see a weight loss of about 10 pounds. A weight loss of about 10 pounds. Now, this particular medication can be used for diabetes, but it's also used by certain populations for weight loss, which is not its primary indication. And so therefore, I am here to promote its only indication, and that is glucose control with proper weight and proper dieting for diabetic treatment. Okay, it's contraindicated, is total in patients who have type 1 diabetes, also in patients who have ketoacidosis, and also those who are renally impaired. Now, caution for nausea, vomiting, diarrhea, caution of headache, anxiety, caution in those who have hypoglycemia, and using other medications with the GLP-1 mimetic. So be on the aware of hypoglycemia if you are taking this medication with another diabetic medication. Okay. Again, it's recommended to take this medication before a meal, 60 minutes before a meal. Store at room temperature for 30 days. As an unopened boxes should be refrigerated in cool temperature. Okay, and then upon dispensing, the pharmacist should actually demonstrate how to inject the medication properly for technique and skill. Okay, and they should measure those before you leave the pharmacy to ensure that the medication is injected properly and the effect is actually is there when needed. Okay, so the next medication, the second medication I'm going to go over is the DTP4 inhibitor. Okay, DTP4 inhibitors also increase the GLP-1 effect. So what they're going to do ultimately is increase insulin synthesis and release by by the GLP-1 effect, blocking the DDP4 enzyme. By blocking the DDP4 enzyme in the plasma system, the GLP-1, which I just spoke about, GLP-1 in the body, the biological protein is actually activated. Insulin is released from the pancreas beta cells, and therefore we get increased insulin, we get less glucose production. Okay, now there is research that has been conducted that shows that this particular class of medication, this particular medication is called sitagliptan. Sitagliptan, or JANUVIA, has been found in research to improve mortality, improve hospitalization, because this medication reduces those rates, reduces cardiovascular disease events. Because of that, less people are experiencing mortality and less people are having to go to the hospital. This particular medication is very, very important, and because it has that particular outcome, other than all of the medications, this particular one has that outcome. Okay, it's right behind the GLP-1 enzyme that I just mentioned. And there's an A1C reduction of 0.6 to 0.9%, not as high as the GLP-1, but it is still very effective. Okay, contraindicated in use with insulin, also contraindicated in sulfonylurea use. Sulfonylurea is a different class of antidiabetic medications that I'm going to go over. Now, sulfonylureas with the DDP4 inhibitor causes low glucose levels or hypoglycemia, which we don't want. So we want to avoid that and avoid insulin use with this particular medication. It's pregnancy category B. Okay, and the adverse effects are going to be upper respiratory tract infection, as well as infection of and inflammation of the pharynx and also the nasal passages. So do be aware of those two side effects. Okay, medications of this class are usually dosed once a day with or without a meal. With or without a meal. So that is a plus as well. So you don't have to eat a meal in order to get the insulin release. Okay, so that is a plus. Now, I do want to talk about JANUVIA or sitagliptan before I move on. It's dosed three different ways, or three different strengths, I should say. And it's also dosed for renal impairment too. So if the patient has kidney disease, they can still take this medication. They can still rely on this medication. It's just that they have to be monitored. And now this particular medication, because it's dosed once a day or twice a day, it lasts about 24 hours. So that is pretty good. And because that lasts 24 hours, and you can take it with or without a meal, that is a very good drug profile. And so I give this medication, and because of the outcome and the mortality rate decrease, hospital rate decrease, I give this medication a 10 out of 10. It's one that I would definitely have on board as a practitioner. And so instead of other medications, this particular one usually is prescribed more readily. Okay, it interacts with digoxin, so be on the lookout for that. If you're taking digoxin for arrhythmia, do be aware of that side effect. Okay, so that was the DDP4 inhibitor. DDP4 stands for dipeptidyl peptidase 4 enzyme. Sitagliptan. There are other drugs in this particular class, but this is the only one out of the class that shows that benefit of mortality rate and hospital rate decrease. This is the only one out of the whole class. So it is number one of choice. So you might have it prescribed or see it prescribed more readily than any other in this class. Okay, and we've gone over the GLP-1 mimetic. Let's go to metformin. Metformin, or GLUCOPHAGE, is the brand name. GLUCOPHAGE medication is dose IR and it's dose ER. It's best to take it with a meal instead of an empty stomach, or with milk, to help avoid nausea, vomiting, diarrhea, upset, dyspepsia, acid indigestion, all of those. You want to take it with a meal. It does reduce the vitamin B complex in the blood system. It does decrease that. It's a known fact. It does decrease weight. There is a weight loss of about 5 to 10 pounds. Also, the A1C will also be affected by 1 to 2%, which is very good. Pre-diabetic patients usually are started on metformin just because it helps to reduce weight and it helps the patient to come off of medications before medications have to be rendered. So if you're pre-diabetic, your doctor may want to put you on a metformin to help with progression or anti-progression of the diabetes. Avoid with alcohol use, excessive use. I would avoid it altogether. Okay, renal and liver impaired functioning patients also should not use this particular medication. Adverse effects, again, B12 deficiency, lactic acidosis, that's the malaise, that's nausea, vomiting, that is unusual somnolence, unexplained hyperventilation. So if that occurs, go to the 911 for further evaluation. Okay. Also, drink plenty of water with metformin to avoid increased concentration in the blood system, and also take with meal to reduce all of the GI upset. It can be dosed in pregnancy and also in pediatric patients. Okay. And this particular medication is contraindicated in males who have serum creatinine or females who have a low serum creatinine. Okay. Also, those who are undergoing radiologic studies should avoid use of iodinated contrast material because of the effects on the renal function. Okay. And also, it's not safe at a certain level of renal functioning. Also, in patients who have heart disease or heart arrhythmia in stage 3 and 4 should use this particular medication with safety. Okay, so that is metformin. Metformin is widely used, and it comes in ER and IR form, and also it is readily available. It is a medication of choice, usually first line. However, in elderly patients, I have a video about that, a particular interaction. Elderly patients who are diabetic are not usually placed on metformin anymore like they were previously. They're now being placed on medications that have organ system protection, who have not only organ system protection, but also works with lowering diabetes safely, reducing risk of falls in elderly, reducing risk of bone fracture, reducing the risk of other risks. So there are other medications besides metformin that are now indicated as first-line therapy. So metformin is no longer first-line therapy in elderly patients. And I have a video about that, so please visit that video, parts 1 and 2. Now, the next medication I want to talk about for diabetes that is beneficial is going to be glyburide. Glyburide is a sulfonylurea. Remember, I mentioned sulfonylurea earlier. Sulfonylurea should not be used with what? JANUVIA. JANUVIA because of the risk of hypoglycemia. Because of the risk of hypoglycemia, we do not want to use the sulfonylurea. Sulfonylurea is pioglitazone. There's two in this class, pioglitazone and rizaglitazone. Now, rizaglitazone is not very used often, but pioglitazone, also known as ACTOS, is used often, and it has 3 different tablet strengths, and it's for, like metformin, for pre-diabetes patients. So if you're pre-diabetic, metformin or sulfonylurea might be a drug of choice to help reduce the risk of having to progress to larger amount of medications. Okay, now with sulfonylurea, there is a weight gain. Let's see. There is a weight gain with sulfonylurea, and that weight gain, okay, weight gain with sulfonylurea. Let me be sure of 5 5 kilogram weight gain. And the brand name is ACTOS. Okay. And usually the dosing is at 15 milligram to 30 milligram once a day. Okay. If insulin is added, okay, if ACTOS is added to insulin, then the current insulin dose can be continued. Now, that may cause more hypoglycemia, especially in elderly patients. So do monitor and test for plasma glucose on a regular basis throughout the day after meals. Okay, it can be used alone or can be used with insulin or metformin therapy, okay? Now, this medication may cause, again, like I mentioned before, this JANUVIA or sitagliptan, this medication may cause upper respiratory tract infection, and it also may cause headache, sinus inflammation, tooth disorder, again, weight gain. Can be taken without regards to a meal, but usually we recommend that to take it with the meal. A1C is lowered by 1 to 2%, just like the metformin, which is consistent, because these two medications are usually dosed together, one behind the other, and it also lowers triglycerides, LDL, increasing HDL cholesterol, because cholesterol, glucose, hypertension, all of those things work together in the body. And because they work together, they can come together to cause adverse effects, or they can be treated to as indicated to help with the other reductions. Okay. Now, drug interactions is contraindicated for patients with heart failure, patients may experience ketoacidosis, which is what we said for metformin as well. And again, it does lower the A1C by 1 to 2%, which is very good versus the newer class of medications. Okay. And its mechanism of action is very different from the other medications, but usually it comes in 3 different strengths. It's one of 2, and it causes edema, adverse effect, and also that's why it's contraindicated in heart failure patients. We don't want lipidemia in those particular populations. This particular class is known to do that, the ACTOS class of meds. And so that particular medication, you might not see it prescribed as often in pharmacies, pharmacy students, medical students, you might not see it prescribed as often because of that effect. So be aware. The last medication I want to go over is insulin. Insulin comes rapid. It comes mixed. It comes intermediate. It comes as long-acting overnight therapy. So do be aware of insulin. I won't go into great detail, but insulin is just like the first class of medication. It's an injectable. It's a liquid. Okay, so skills and knowledge about demonstrating how to use it has to be performed from the pharmacist or the doctor nurse to make sure that medication is injected and the insulin is getting there. Nowadays, there's the new device, the diabetic system, where it's implanted on the back of the arm or is implanted along the side of the body to inject insulin throughout the day. Continuous release is what they call it. So that's new. And a lot of patients are doing that now, especially a lot of the younger patients, a lot of male patients, older male patients are utilizing these now. But the insulin injections are still very much prevalent and relevant. So I do want to go over the insulins. Humalog and Novolog are a rapid release, and they are dosed about 15 minutes, 30 minutes before a meal. And they're dosed usually 3 times a day with meals to help bring that insulin glucose down right after eating. Okay, dosage must be individualized because, again, it's dependent upon the diet, the carbohydrate intake, also a patient's tolerance to insulin. Insulin is like a hormone, so it causes weight gain. Yes, it does cause weight gain, And there are different brands. Usually syringes are needed. Alcohol wipes are needed. Pen needles are usually needed. So, excuse me. So if all of these are needed with insulin injectables, now some insulins come pre-packaged and are covered by the insurances. If you are a user of some medications, you might want to use precaution. Store these medications in the refrigerator. Do not freeze. Hypoglycemia may be an interaction. They can be used with metformin. They can be used with sulfonylureas to help bring hyperglycemia down to normal levels. Okay. Also, hypersensitivity could occur as well. They promote transport of certain enzymes to help increase the insulin production, and also the half-life is 1 hour. Okay. Now, long-acting form is called detamir, or also Lantus is long-acting, usually given right before bedtime to last throughout the night. And then in the morning, patients test their blood glucose at that particular time. So just know that there are different combinations as well. NPH, which is a preservative, which of they're at rapid acting. It's a preservative, making it a little bit longer to last in the body as an intermediate form. So that's usually twice a day dosing. The glargine Atlantis is once a day at night, and then the rapid release, of course, is going to be your 3 times a day with meals. And then there's a mixture again with the protamine, or the as 70% protamine, 30% short acting. Protamine is like the NPH, so it extends the duration of action of the rapid acting. Okay. And then there's the pump infuse, or the continuous administration that is new on the market, and most people are now taking this new device. I'll talk about it briefly. This new device, it monitors. There's a new device that monitors the blood glucose level. That way, the patient doesn't have to prick their finger. They don't have to carry around a device bag. It's already embedded under the skin by the doctor's office, and then all I do is swipe or scan that little barcode that might be there and get a reading. Once they get the reading, they have their glucose monitored. Okay, so do be aware of that. And it's very convenient, and it was the 5th product that I want to talk about, just because it's very prevalent, and they were once being produced through animals. Now they are insulin is now genetically produced through human, through genetics. So again, it was once produced through animal genetics. Now it's produced through human genetics, and it is a primary hormone responsible for carrying out proper glucose utilization in metabolic processes. So that's all I have for today. If you have any comments about the 5 medications that I talked about: metformin, JANUVIA, GLP-1, also insulin, and then the sulfonylurea class of medications, please leave any comments or topics that you would like to hear about. I'm Dr. Erica. Thank you for joining me for this particular topic. Please see my other videos about diabetes and the new diabetes medications that have recently been approved. The new ones are, don't get me wrong, there's 2 new ones that are out on the market that are mimetics, injectables. And then there's a new one, tablet form, that is also new, and it stops the progression of type 1 diabetes. And so those are the 2 new classes of medications that have recently come out. And so do please visit those videos as well. Visit my website. Please subscribe. And thank you for joining me on this particular video. I hope to see you on the next one. Bye-bye.